Hello, good evening, good afternoon, good morning, and welcome. It's Nurse Richard, the Wax Wizard. Thank you for joining me. I think that's probably the silliest intro I've ever done. I enjoyed that one, though. Let me know what you think. If you don't like it, I'm not really bothered, but I think they're fun. It's the first one here. Very simple removal. It was a perfect one for forceps. You could just see a little lip on it, a little gap over the top. So fairly easy to pinch that and pull it out. Hearing aid user, this gentleman, it was his second year that gave me a world of trouble. You can probably see why. Hence the title of this particular video. It was just stuck to the base of the ear canal, and when I say stuck, it was as stuck as a very sticky thing in a very sticky situation. It's pretty stuck. And the first one, it was, you could see it was kind of bowed inwards like that, where he pushes his hearing aid, and obviously when he's pushed his hearing aid into this ear, it's kind of smushed it into the base of the ear canal, and it didn't get anywhere with the suction on that one. So I had to go with a Rye Curette here, and this didn't help too much either, because, well, it helped to some degree. But it's right in the bony bit this, so I do have to be very careful not to graze against the ear canal. But it's even too firmly stuck to try and scoop under it with that. And it's normally really good at that kind of thing, but that's how stuck this thing was. So I thought that it might have felt that a little bit. So I abandoned that. I thought, what's the old saying? Sod this for a game of soldiers. Where does that come from? I don't know. So what I did, I threw a load of olive oil in there in the hope that I can get a better grip with it. The image does get a bit clearer in a second. I've had to cut out about 2 minutes of this particular ear, just because every time I went in, because he's got one of them ears that's like kind of like really V-shaped at the bottom, a lot of the oil was just collecting inside that. And every time I put the endoscope in, because I needed to have the endoscope at the base of the ear canal to see this, there was just oil flying everywhere. It was a right bubbly, blurry mess. So I thought, you don't need to see all that, but take my word for it. It was a pain in the neck. And it worked. So as soon as we lifted it up and a bit of the oil seeped down underneath, this thing was a lot easier to grab hold of. And I think it came out in one failed swoop. Because it wasn't much, but he did notice a difference. God bless him. Lovely man he was. So just a tiny little bit of tidying up around the outside, and I'm just going to see if I can grab that hair while I'm there. And I don't know why it's a black hair either, because the hairs on his head weren't black. So where that comes from, who knows? An eyelash, an eyebrow, one of his wife's, one from his chest. Who knows? Who knows? Right, now the second one, this was a young-ish lady, and this happens quite a fair bit, and it's really unfortunate when it happens like this, because it's not an excess production of earwax that causes this. It's kind of an anomaly in the epithelial migration process. And what's happened with this lady is the skin. I explain it this way to most patients. Imagine a snake shedding its skin, just sheds it slowly off sideways like that. And the ear does the same thing. A lot of you regulars, I know you'll know this. But what happens in some patients, and I see a couple of these a week, is where the skin's been shed. Imagine this is the roof of the ear canal and it's shedding along, or at the base and it's shedding along. For some reason, it might be because there's a slight bend in the ear at that point. Pull that out with forceps. A few tools in this one today. Not like me, eh? For those who say, never uses them. I do. I don't show many videos of it because they don't last very long. Anyway, as the skin's sliding along, it might reach a little a bump or a dip, and it kind of curls over. And as it slowly migrates sideways, it curls over, and then it can actually like close over. The ear canal kind of fold either upwards or usually downwards. And that's what had happened there. And it happened in this one too. So it's kind of started shedding back in on itself. And it's at that point that the patient can't hear. You can see how far down this goes, can't you? And it's quite a thick layer of skin as well. And I think I put oil in before I did this ear because I suspected it may be an issue as soon as I looked at it. And I think we did need the forceps eventually on this one, or did we? I can't remember. But what I wanted to do, rather than just yank it out with the forceps, because I think it's quite dry and quite stuck deep down there. So I think if I just grabbed it with the forceps and pulled it out, I think that might be quite uncomfortable and it might cause some trauma. So what I'm trying to do is just hold on to it with a suction and just to try and wiggle it side to side, and that helps for the oil to seep down underneath it, so it makes it a bit more comfortable to be removed. And almost all out there. It's a bit of a compilation again today. I think the video's about 15 minutes long. There's 6 ears in total. I think we've already gone through 4, haven't we? Yeah, the last 2 a bit longer, bit trickier. And so I'll pull that out with forceps. Again, there's a couple of loose layers there. Not entertaining getting them. If you start peeling something like that when it's no benefit to it, then there's absolutely no point. Absolutely no point at all. Starting to lift that. The skin beyond that is probably not dead yet anyway. And we don't want to pull out living skin. The patient wouldn't thank you for that. So this one, this was ages ago, not years ago. This was ages ago though I did this one, and I can't remember too much about it other than I've titled it "Small and Sticky." So I can see why I've called it small, because you can see the gap there that I'm trying to negotiate these things past is pretty tiny. And I think it was the other one actually that was a bit more sticky than this one, but still both pretty sticky. Sorry, I'm itchy again. I think it's since, and this is another reason why I don't always do water, because I have to do my own ears if you're wondering what I'm on about. I think in the previous video I shared that I think I've given myself a bit of irritation in the ear. I'm thinking back, every 9 to 12 months ago or so, I have to sort out my own ears because they do get a bit bunged up. I get quite a lot of dry skin in there, so I do oil them frequently. But it gets to a point sometimes, and it just becomes a bit muffly. So I do understand what a lot of these patients are going through. Now, it's nigh impossible and not really safe to do suction on yourself. It's just not physically possible. So I do irrigate my own ears every now and then. And that's always been fine. It's always worked absolutely fine. But the risk, and this is a small risk with irrigation, is that you rinse away some of the natural oils that are there to protect you from infection, and you kind of reduce you get rid of that. You disturb the pH balance because the ear is slightly naturally acidic, which helps to prevent the bacteria and fungus that are naturally in your ear from taking over. So that's the small risk that there is of irrigating anyone's ear. So I irrigated mine, and then I noticed about a week later it started getting really itchy. It's not an infection per se, but it has been driving me daft, the itchiness. And if you ever wonder how to itch your ears, easy way, well, the only way that you should do it is I've been putting some spray in. I've been putting some acetic acid spray in, which has been helping. But then when you put it in, obviously stay on your side for a good maybe 10 minutes or so to allow it to work, and then tip your head the opposite way after that to allow it to drain out. But you just close the tragus there, the little fleshy bit you can see just before your ear, the little squidgy bit. If you close that and rub it up and down, it's a good way of relieving an itch without actually going inside your ear, because you don't want to go inside your ear. And it's still itchy, but it's getting better. So I do have some empathy for what my patients are going through, because I do have. If I didn't do mine every 9 to 12 months ago or so, it would get to that point where it was I'd need something like this doing. So I just keep on top of it. It's not that I don't trust anybody else to do them for me, but who am I kidding? Yeah, it is. I don't trust anyone else to do them for me. Maybe that'll change. Who knows? Now I can see why I've called this sticky now. It is very sticky, this one. And I think I probably mauled around with this a bit too long before it came out. But hey, it is what it is. Anyway, I'll not do dad jokes today. I'll do nurse jokes, because we've not had any of them for a while. And if you're wondering what the bejesus is on about, every few videos, just tell a few little puns just to lighten the mood a little bit and to keep myself entertained, because as I've said many times, perhaps it should be one of my catchphrases, along with another wax baby safely delivered. There's only so much you can say about an ear before you run out of things to say. That's why I go on about some other stuff sometimes. Right. Nursing jokes. I like this book. This is one of my favourite ones. These are patient nurse interactions. Whether they're real ones or not, I don't know. But I have had similar conversations with patients of mine in the past. Patient says, "I've lost my memory." Nurse says, When did this happen?" Patient said, "When did what happen?" Patient, "Everyone thinks I'm a liar." Nurse says, "I can't believe that." Patient says, "Have you got anything for my liver?" Nurse says, "How about some onions?" I used to like liver and onions. It was quite a popular dish when I was a kid. Mum was forever making it once a week. I did like it to start with, and when I found out what it was, I didn't have the heart to tell her, "Can you not do this anymore?" Right. Patient says, "I feel like a needle." Nurse says, "I see your point." See if we can find some good ones. Patient says, "I keep seeing double." Nurse says, "Please sit on the couch." Patient says, "Which one?" I can empathise with that. I was born with double vision. I don't know if I've shared that before. They just thought I was a clumsy kid. Just kept bumping into things and dropping things. But yeah, it turns out I had double vision. I saw two of everything. I didn't think it was, I just assumed it was normal. It clearly wasn't. 4 operations later, 20/20 vision. Oh look, got another tool out. Who'd have thunk it, eh? Right, receptionist in a doctor's surgery says, "There's a man in the waiting room with a glass eye named Brown." Nurse says, "What does he call his other eye?" Patient says, "I think I'm a bridge." Nurse says, "What's come over you?" Patient says, 6 cars, a truck and 1 bus. These are very silly. Nurse in the ER says, "So what brings you here?" Patient says, "An ambulance." Let's have a couple more because we're almost done in this one. Patient says, "You've got to help me. I just can't stop my hands from shaking." Nurse says, "Do you drink a lot?" Patient, "Not really. I spill most of it." Oh dear. Nurse said, last one. Nurse says, "Did you know that there are more than 1,000 bones in the human body?" Receptionist says, "Shh, there are 3 dogs outside in the waiting room." Oh, they're good ones. Have I finished yet? Anyway, if you have enjoyed this, please feel free to subscribe to the channel. I would massively appreciate it. Loads of you watch them. More than 3/4 of you who are watching this have not subscribed to the channel, so please do so. Anyway, I hope you enjoyed that. But for now, take care of yourself, and I'll see you soon. Ta-da.